At the end of the month, Streus retail pharmacy in Greenbay will shutter.
One patient said, "I've been with this pharmacy for over 50 years. I have never gone to another pharmacy in my adult life." That was heartbreaking.
Nicole Schreiner, the CEO and a pharmacist at Streus, says the sole reason behind closing that side of its operations is because of the middlemen between pharmacies, drug companies, and insurers. They're called pharmacy benefit managers, or PBMs.
And the whole purpose was for them to help insurance groups manage the medication portion of their insurance benefit that they were offering patients, to control costs.
While originally created to manage claims and costs, PBMs have now accumulated immense power. They are judgment makers about drug claims, patient access, and pricing.
If you're going to be a player in the pharmacy, you are forced to work with PBMs. There's no way you cannot.
Nick Smith is the owner of Smith's Pharmacy in Little Chute.
If you're going to bill insurance, they are what control the whole process. They see all the data, they see all the claims, and they control reimbursement. They even control where the prescription goes.
The American Medical Association says 4 main PBM companies control more than 70% of the market, nearly monopolizing it. Schreiner says they're taking full advantage, too.
And now there's numerous studies that even show that they are actually costing health plans more money than saving them money. And that's because they get rebates on branded products when there are cheaper generic alternative products available.
Then they started having their own pharmacies, and now they're even having their own providers. So now you're seeing them kind of push people towards their own pharmacies and try to cut us out of the equation.
Smith and Schreiner say their local pharmacies, and almost everyone else, is forced into cutthroat take-it-or-leave-it contracts by and with PBMs. Those contracts include nearly non-existent reimbursement rates for when pharmacies dispense a drug to a patient.
We're getting reimbursed below cost. On one drug alone last year, we lost over $250,000 on one drug alone.
Some pharmacies have resorted to no longer carrying more expensive medications to avoid such big reimbursement losses.
We have not refused to fill anything based on reimbursement models, but that number of prescriptions that are filled for a loss just continues to grow, and I don't know how much longer we can do it.
If it costs them $100 to dispense a drug, PBMs are paying pharmacies back sometimes as little as $4. That's what has driven Streus to close its retail operation.
We couldn't figure out a way to make it make financial sense.
The predicament is driving the closure of pharmacies, especially independent ones, and stopping new ones from opening.
We don't ask to get rich. All we want is a fair reimbursement. Reimburse us a cost plus 10%. That's all we're asking.
And pharmacy closures, both local and national, create access gaps.
Patients are not going to be able to find a pharmacy to get their prescriptions filled.
Honestly, that's my biggest fear.
The only way to change the current model is legislation. In Green Bay, Marlo Lundak, Fox 11 News.